We're above average nationally in need.
It's not a new problem for the city of San Antonio, it's an old one.
We've also always had that unenviable distinction of being the city with the greatest economic segregation.
But existing inequities have been made worse by the COVID-19 pandemic. Many already on the brink were pushed over the edge and forced to seek help.
It's challenging, and we have our ups and downs. Luckily, my wife is still working.
We only get Social Security, and it's not enough.
They were just above the poverty line, but not far enough above. Literally that paycheck away from a crisis.
The workforce that's most vulnerable among us, I mean, with the least education and the lowest income, they're getting hit the hardest.
This week, we're continuing our conversation on the uneven impact this pandemic has had on the Alamo City.
KSAT Explains.
KSAT Explains. KSAT Explains.
KSAT Explains. On-demand, in-depth perspective. Perspective on stories we bring you in our newscasts throughout the day. We're looking into concerns over voting safety during a pandemic and the battle over mail-in voting. A look at how the protests and demonstrations have played out in our city and an examination of what it means to be black in San Antonio.
An issue that you have likely felt the effects of, rising property taxes.
The roots of Tejano run deep in South Texas. We examine the cultural impact the music has had in San Antonio.
The impact of the pandemic has been uneven in the city.
All of us have felt the impact of COVID-19. It's a virus that has ravaged economies, filled up hospital beds around the world, and created a new normal that we are not likely to soon forget. But it's become increasingly clear that this pandemic has not been even in its impact, and we've seen it put a new spotlight on issues that have existed in our city for years now. This moment forced a conversation, and in part, we can thank these now iconic images from an April food bank distribution event. A lot of people we talked to say that among the disturbing facts about this event and food distribution events that have happened since is that not all of the people in these lines were unemployed. Experts say the issue lies with the makeup of San Antonio's workforce. Some of the industries hit hardest by this pandemic are the ones San Antonio is best known for.
This was, the worst of all possible economic disasters for San Antonio.
The restaurant and hospitality industries have all fallen victim to a virus that is currently best fought with physical distance. The drop in tourism alone has dealt a major blow to San Antonio's normally thriving tourism sector.
And the rest of the tourism industry kind of folded from there. It was like, a line of dominoes going down.
Here's a look at some of the industries that employed the most San Antonians in May of 2019. The list includes healthcare, food services, and office jobs. But San Antonio has had a problem attracting jobs that require higher levels of education or skill. A study by the Federal Reserve Bank of Dallas identified a continued shortage of skilled workers as a barrier for growth in high-paying sectors.
If San Antonio wants its share of those jobs, which are higher paying, it's going to have to have a workforce that's trained up to actually do those jobs. Right now, it's not looking really good.
And it's kind of a chicken or egg kind of thing. It's like, well, if you have a skilled labor force, then eventually the jobs will come here. It can be the jobs are here, and in fact, this is probably true for Texas. I mean, we've grown jobs and we've imported a lot of skilled labor.
Living under the stress of this global health crisis has been made worse for people who have lost their jobs as a result of it. That economic fallout has been significant in San Antonio, not just because the industries hit the hardest, like restaurants and tourism, are some of our biggest local moneymakers. Before the pandemic hit, the Alamo City was already dealing with the problem of people being underemployed, meaning they don't have a job that uses their full skill set, and as a result, they aren't able to earn an adequate living, enough to comfortably feed their family and afford a place to live. And that has tied in directly to how this virus has affected parts of our city in different ways.
So if you go, for example, to the near west side, just west of I-35 downtown. There are really high levels of poverty there, low levels of educational attainment, low levels of internet access. And then if you look, if you get on and look at the city's dashboards, they have a map there about infection rates. That whole area there has one of the highest infection rates.
San Antonio also has a lack of higher education among people who live here. It's called educational attainment. A lack of education prevents a lot of people from learning the skills they need to get the jobs to make the money they need, leaving them struggling more than most in any crisis, and certainly in our current one.
This was critical, again, before the crisis hit, because it's 65% of jobs require something beyond a high school degree. So in this moment of us focusing on workforce development, us seeing that the service industry is rising at the top in terms of unemployment claims, what is the possibility for us to be thinking about the combination of education and workforce together, as well as the other industries or areas of the community that need significant investment that make this possible, whether that's public transportation or health insurance or a safe and affordable home. Again, all of that is interrelated.
Now imagine being on the verge of homelessness before this pandemic hit, or working hard to transition out of homelessness and get back on your feet. Then the COVID crisis begins. The coronavirus has only added to the weight of an already heavy burden of San Antonians who are in these situations. It's also forced people to seek help from organizations like SAM Ministries for the very first time. We talked to a woman named Sherry, who's been living in a storage unit that she rents. She was about to finally get a place of her own. Then the shutdown came.
It's kind of unconventional. I've been staying in my storage facility, in my storage unit. That's, $675 a month.
$675 a month for 2 storage units Sherry Burnett currently calls home. She's living there illegally and paying for it through federal assistance. An apartment of her own, she says, is too expensive because they often require tenants to make more than the monthly rent. So she turned to the San Antonio Housing Authority and got a voucher.
So I finally get my housing voucher after all this time, because I had been on the wait list already since 2016, I think. And a week later, the world shuts down. I couldn't go look for a place to live, and my voucher was expiring.
Sherry has been working with SAM Ministries since last fall, the organization that helps people out of homelessness, not untouched itself by the challenges of COVID-19.
When the grocery stores were first out of toilet paper and paper towels and disinfecting wipes, our clients had barriers relative to getting to the grocery store just to find those shelves empty. And so how could we adjust in that way with those critical and needs?
Also critical, face-to-face interaction when connecting the homeless with services. Social distancing and a shutdown made that even tougher.
If we say we're going to do something, we have to do it. If we say we're going to be somewhere, we have to be there. They may not have a phone, or if they have a phone, it's a Wi-Fi phone, so they have to be connected. They have to be somewhere where they can connect to a Wi-Fi signal in order to return a call.
Then there have been the new faces during this pandemic.
I think it hit home for me in June when we got the phone call from someone seeking rental assistance who lives in a $1,000 a month, 1-bedroom apartment out near the Rim, who had been laid off at the end of March, and she didn't have resources to pay, or she didn't have income to pay April rent, May rent, now June rent is coming. I've exhausted all my savings and I don't know what else to do. That's not normally the face of the person that comes to SAM Ministries for help.
SAM Ministries has had to pivot, as we all have, learning how to continue their mission in this new normal. But the uphill struggles their clients face are not over. Brian says mid-August will be telling when a federal moratorium on evictions could end.
Because there's a lot of properties right now that are still protected under that, where they can't file an eviction, they can't collect late fees, they can't do anything yet. But that day is coming pretty quickly.
For Sherry, some good news. She's finally scheduled to get that Saha apartment. The challenges of this pandemic have been mighty, but she says, so is her resolve.
Wanting to do better and live life again, I'm kind of trying to push through all those things.
YouthQ positively impacts young men and women through the power of choral music nationally and here in the Alamo City through the San Antonio Youth Chorale. SACY not only helps the youth but the community as well. Now they need your help as they raise their voices to aid the San Antonio Food Bank. $1 can make up to 7 meals. So show your support by making a donation at the link on your screen.
KSAT Community, in partnership with Energy Transfer, RBFCU, and University Health System.
Feeling a little frisky?
Then get ready.
It's the summer of me on Me TV.
Chill out with some hot classics.
Watch Me and My Family on Mama's Family.
Laverne and Shirley. Happy Days.
Stay cool with Happy Days all week long. Plus, Laverne and Shirley, Mama's Family, and Brady Bunch themed episodes every weekend.
Spend your summer at home with Me TV San Antonio, found on these local channels.
You've seen the headlines: outbreaks at jails, prisons, detention centers, and nursing homes. These types of congregate settings have become COVID-19 hotspots. The problem, it's not easy to keep people separate in these places. The Bexar County Jail had its first confirmed case in late March. RJ Marquez breaks down how the situation has progressed since then.
When the pandemic hit our area, the Bexar County Jail had about 3,800 inmates. That was in early March. Sheriff Javier Salazar knew he had to take preventative measures to reduce the possibility of COVID-19 spreading in the jail. They included using staff from University Health System to pre-screen inmates before entering the jail, conducting temperature checks on inmates twice a day, booking and housing inmates showing flu-like symptoms separately, suspending the work release program, screening visitors before entering the video visitation facility. New inmates went into quarantine for at least 2 weeks. Eventually, some nonviolent offenders were released to reduce the jail population, and a recovery unit was set up for inmates with the virus who didn't need to be hospitalized. On March 29th, the sheriff announced its first case, an employee. The employee worked in the video visitation facility. The sheriff said that the employee had returned from a cruise on March 15th and was asymptomatic while at work. On March 18th, the employee reported feeling sick. The next day, they were placed on administrative leave. On April 10th, the sheriff's office announced its first positive case among inmates. That pushed the sheriff to provide inmates to wear surgical masks and restrict time in the day room. But inmates said they were using the single-use mask for days. Alejandro Alvaro said he wore his for more than a week despite it being damaged.
It had a hole in it, I had to puncture different holes to fix the mask myself.
We did provide a mask to every inmate. We've asked them to try to use it for 2 or 3 days because we don't have enough supply.
The jail eventually got enough masks for inmates to change daily. By April 29th, 98 inmates had tested positive. On May 4th, 66-year-old Clifford Childs became the first inmate to die due to COVID-19 complications. He was in the jail on 2 murder charges. As of July 6, there have been 547 COVID-19 cases among inmates. Now every inmate gets tested before entering the jail.
Nursing homes and other long-term care facilities have also become COVID-19 hotspots in Bexar County. There are 68 nursing homes in San Antonio. The first outbreak began at the Southeast Nursing and Rehabilitation Center. In early March, COVID-19 restrictions were put in place across the nation, barring people from visiting their loved ones at nursing homes or other long-term care facilities. On March 31st, Metro Health and the San Antonio Fire Department announced an outbreak at the Southeast Nursing and Rehabilitation Center on South Cross. 12 people tested positive for COVID-19. At least 1 resident had died. The defenders uncovered that a week and a half before the outbreak was announced, an employee raised concerns to multiple supervisors that a fellow therapist had continued to work there despite possibly being exposed to COVID-19.
I do have a big sense of guilt because I feel like I probably should have pushed the issue harder. I think about what if that were my parents or my grandparents.
On April 3rd, Mayor Ron Nirenberg barred staff from working at more than 1 nursing care facility. That's because some of the Southeast nursing staff also worked at other facilities in Bexar and Wilson counties.
If you are a staff member of this facility, you must respond to the notice to be tested. We need your cooperation to stop the spread of COVID-19.
By April 15th, 17 residents had died. On May 11th, Metro Health confirmed an outbreak at a second facility, the Rio Admission Trails. At least 16 cases reported. On June 16th, a family who lost their loved one sued Southeast Nursing and Rehabilitation Center. He was one of 18 who died. And at least 75 residents and 29 workers tested positive for COVID-19. Contact tracing helped Metro Health identify that Southeast nursing staff were working at other facilities, but could not determine how the virus got into the nursing home in the first place. The state keeps track of long-term care facilities with COVID-19 cases and deaths, but it does not release the names of those facilities due to the state's expansive medical privacy law. According to data from the Texas Department of State Health Services, more than 1,100 residents at nursing homes and assisted living facilities have died. Metro Health has a list with names on the COVID-19 data website, but it only lists locations with active cases. Right now, there are 14 facilities with cases.
I'm here.
I'm here.
I'm here.
I'm here.
I'm here. I'm here.
There are thousands of special needs caregivers in our community. Every day they serve as champions of compassion to a family member, a friend, neighbor, or an employer. They have served a special role during this pandemic that cannot be overlooked and must be acknowledged. Let us take this opportunity to thank the caregivers of the special needs community who are serving as warriors through their unselfish desire to make a real difference in the lives of our friends with special needs. Together, we are making a difference.
We've talked about the problems, so what are the proposed solutions moving forward? Our city has learned some hard lessons during this pandemic, but the hope for progress and change remains. In our conversations with people for this episode, there were a few goals that were brought up repeatedly as necessary to bridge some of these gaps. Things like education and making sure people are paid a fair living wage.
Last decade alone, we have proven through things like pre-K for SA that when we have a shared goal and we work towards it, it uplifts the entire community.
We're beginning to see some of that in terms of some of the stimulus funds that the city is using, partnering with universities.
Right now, we actually have an opportunity to provide some job training that actually will prepare people who are now, who are maybe in hospitality and leisure jobs. Were laid off.
We have to have the conversation around a living wage. What does it take to make it in our city? We have to have the conversation around personal time off, the ability for an employee to take time away from work without losing their income.
We have made significant progress. We have to make a lot more to get to a place where we're seriously addressing the issues of income inequality here, and that's also true statewide.
Many of the people you've heard from are educators or people who study demographics in the community. But what do our elected leaders have to say about the inequalities in our city and how they should be addressed? RJ Marquez with a rundown.
KSAT sent this question to all 10 city council members, asking them which policies they support including in the budget to help address inequality. So how did they respond? The need for affordable housing and infrastructure improvements were popular answers. In fact, council members from districts 1, 5, 9, and 10 all pointed to these two issues as key moving forward. Jada Andrews Sullivan and Rebecca Villagran said they want policies that will dismantle systemic and institutional racism and are also calling for police reform. The councilwomen represent districts 2 and 3 respectively, which cover the east and southeast sides. The need to fund social services was mentioned by council members in districts 1, 4, 9, and 10. Dr. Adriana Rocha Garcia, John Courage, and Clayton Perry specifically mentioned fixing streets and core services. Engaging and educating the public on assistance programs was another answer we got. District 6 Councilwoman Melissa Cabello Haverda said she conducted a direct mail campaign last year. And District 7 Councilwoman Ana Sandoval said barriers to information need to be removed for many people in underserved communities. A major issue spotlighted by the pandemic has been the digital divide. A couple of council members want to make sure this is addressed in the next city budget. District 5 Councilwoman Shirley Gonzalez said more needs to be done to help neighborhoods lacking internet access. Manny Pelaez represents District 8. He says digital inclusion initiatives are his priorities and increasing accessibility to the internet for school children. Some other things mentioned, transportation. District 1 Councilman Robert Trevino says the city needs to include transportation in the creation of a social safety net. District 9 Councilman John Courage wants to focus on homeless and workforce issues moving forward. And District 10 Councilman Clayton Perry said much more can be done when it comes to supporting small businesses that help people get jobs and keep the economy moving.
I had a chance to talk to Mayor Ron Nirenberg about these issues in the context of this current global health crisis. He says he believes the city has taken some first steps in the right direction towards recovery post-pandemic and addressing some of these long-standing issues. Here's our conversation. What are the biggest inequalities that you have seen really be highlighted throughout this pandemic in San Antonio?
The pandemic has hit our community extraordinarily hard. And you've seen it exacerbate existing inequities, particularly among communities of color and those communities in lower socioeconomic income brackets. It has disproportionately affected the people who can least afford to be impacted. And that's why it's shaped our approach to the recovery effort, from the immediate crisis response to how we're going to rebuild our community when we're through the immediate health crisis. We're focusing on the essentials. How do we make sure that people don't lose their homes as a result of coronavirus? How do we make sure that people continue to have food on the table to feed their families during the coronavirus and afterwards? And then from an employment standpoint and making sure that people can sustain themselves, how do we get people back to work when it's safe? And for many, too many, how do we ensure that those whose jobs may not come back very quickly or come back at all have a pathway to a sustainable career after this? So that's kind of where we are, but we've seen San Antonio be very heavily impacted because of the existing inequities, which are found throughout the country in urban areas like ours.
And like you said, these were problems that existed well before this pandemic hit, and they are not problems with easy solutions. There's some that maybe have been around for generations for a lot of San Antonio families. So what work is being done now on top of the work that's happening moment to moment trying to prevent the spread of this illness? What's being done to try to keep those families, those communities either on track or get them back on track?
Well, I mentioned some of them, simple food, shelter, essentials. But we also have to recognize, in order for us to have a healthy community at any level, we have to have healthy people. And so our response has to first consider the fact that equity results from health and well-being. So making sure that we're reaching communities and ensuring there's testing available, there's information about preventative health maintenance available. Beyond that, we have to look at our systems of inequities. There is a level of generational poverty that we have to focus on and break here in San Antonio. And that has a lot to do with education, providing people pathways to post-secondary education, technical certificates. So we have had to take a systematic and comprehensive look at the way we build our communities in order to overcome some of these systematic inequities and deficiencies that we've had for generations.
There are people within the San Antonio community who have not had to seek out those resources like the food bank during this pandemic. They have not lost their jobs. They have not been furloughed. Maybe they're just having to stay home and focus on their health. What would you say to those people who haven't really seen these big problems arise in their own homes? Why are these other issues that may not be affecting them, why should they care?
A lot of people talk about urban areas like ours, particularly San Antonio, as being a tale of two cities. There are many people in our community that the pandemic is an inconvenience, for sure. It's an inconvenience. But their livelihoods are by and large intact. But there is a whole other side of this world, a whole other side of our city, where people are not as fortunate. I would simply ask folks who weren't so dramatically hit by this pandemic to consider the people that we share our community with. In order for us to have a healthy city, a healthy community, we have to bring everybody back up. Everybody's got to get back on their feet. And so it requires us to focus on those who are most disadvantaged in our community to ensure that they're okay, that they, again, are able to make ends meet, they're able to feed their families, they're able to keep a roof over their head, and they're able to get to a career that allows them to do that even as we get past this pandemic. San Antonio was the first big city in the country to begin using an equity lens, an equity framework in order to allocate its resources. And we are by no means even close to restoring the levels of equity that would be required for us to have a resilient city. But we have taken the first significant steps before this pandemic, and the pandemic has illustrated why we need to continue to march in that direction.
Is there anything else about this very big topic that we didn't cover you think is important to note?
No, this is very big. What I would say though is that this has been disruptive to us here in the city of San Antonio. It's been disruptive to every city in the country. It's been disruptive to the entire world. No one would have foreseen the earth-shaking nature of this pandemic a year ago. But with this and with the moral crisis that we're seeing, with the March for Justice that's happening, we have seen a reckoning in our communities all across this country, and a real opportunity. Every social and economic institution and structure is having to reconcile the vast inequities that have been built in, that have left some people out of prosperity, have left some people out of systems of justice for generations. But what these last 6 months in America have provided us an opportunity to do is take a full accounting of that in full view and allow us to rebuild and restore our community in a much more equitable manner, not just in San Antonio, but across the country. And that's a real opportunity. That's a real generational opportunity for us to leave a better world to our children and grandchildren.
A lot of heavy lifting still to be done. Mayor, thanks so much for your time.
Night Beat. The day isn't over.
It'll be a very tense situation. Folks, this is live.
It's what's happening right now.
He heard the shots and ran for cover.
She was not allowed to record video or take pictures.
More investigations.
Crooks to break into a bar, then drive off with a whole ATM.
You have no idea how long employees were exposed.
More stories affecting you.
This will be a major traffic nightmare.
Working to bring you more.
Night is not over just yet.
The Night Beat.
Well, it is hot in Texas, and that means summer is here and hurricane season has arrived.
And hurricane season itself is a pretty long haul. It lasts for 6 months from the 1st of June all the way through November 30th.
Yeah, so it's technically still hurricane season when we're carving the turkey on Thanksgiving, and you might not instinctively put hurricane season and Thanksgiving together.
And that's because some of the parts of hurricane season are a little bit more active than others, and that includes closer to home in the Gulf of Mexico.
So this week, join Sarah and I on a little dive into the climatology of hurricane season. Let's start with a look at where tropical systems develop. So if you go to the National Hurricane Center's website, you'll see 3 different areas being monitored. The Eastern Pacific, which includes Hawaii, the Central Pacific, and the the Atlantic Basin. So for today, we're going to stick to talking about the Atlantic Basin because it's a pretty big place. It actually includes all of the Atlantic Ocean, the Caribbean Sea here in orange, and the Gulf of Mexico there in purple. And if you'd like to break it down and be even a little bit more specific, you can throw in the Bay of Campeche there in red near the Yucatan Peninsula and the Cabo Verde Islands off the coast of Africa. All of these polygons represent different regions where tropical cyclones can and have developed historically. We're going to come back to talking about these regions in just a minute, but let's first look at the overall climatology of hurricane season in the Atlantic Basin. So what you're seeing here, this is the number of storms over 100 years spread out across the whole season. So what probably catches your eye first is this big spike in the middle. This means that the period around September 10th is generally the most active part of the whole hurricane season, with between 90 and 100 hurricanes and tropical storms developing around this time over the past 100 years. Compare that to July 10th, and only about 10 tropical systems and hurricanes have developed around then in the last 100 years. What this also tells us is that, generally speaking, late August through early October here, this spike, that's historically when most tropical storms and hurricanes develop in the Atlantic Basin. It's also important to note, though, while the early and later parts of the season generally have much less activity than the middle portion there, that doesn't mean that powerful storms can't develop during those times. There generally are just fewer of them. All right, back to our map of the Atlantic Basin. Let's look at what months tropical development is more likely to occur in these different regions. So June and July, where we are right now, typically less active months. Tropical development, though, is more likely in the Gulf of Mexico, the Bay of Campeche, and in the Caribbean. Fast forward to August and September, as things start to become a bit more active, development becomes possible over a much larger area, essentially anywhere in the Atlantic Basin. The Atlantic Ocean itself becomes more active, as does the Cabo Verde region, where tropical waves often come off the continent of Africa and can organize into a tropical storm or hurricane if the conditions are just right. Now, as we get into October, things do start to quiet down a bit near Africa and the Cabo Verde Islands there, but development becomes more likely in the Atlantic, the Caribbean, and even still in the Gulf of Mexico. And by November, the tail end of hurricane season, things typically really slow down, and development is generally only seen in portions of the western Atlantic Ocean. And one more thing to consider, while tropical development is more favorable closer to Texas in the Gulf of Mexico, during certain parts of hurricane season, a tropical system can develop elsewhere outside of the Gulf and still affect the Texas coast. Take Hurricane Harvey in 2017, for example. Harvey began as a wave near the Cabo Verde Islands there off of Africa. It traveled all the way across the Atlantic Ocean through the Caribbean. It weakened over the Yucatan, but reemerged in the Bay of Campeche and eventually moved into the Gulf before making landfall near Port Aransas, Texas on August 25th.
Hurricane season in the Atlantic Basin runs every year from the 1st of June all the way to the end of November. And on top of that, every year, the National Oceanic and Atmospheric Administration puts out an outlook, or basically a forecast of what they think the season will look like. Now, this year, they put out the prediction that there will be 13 to 19 named storms. That's tropical storms or greater with wind speeds of 39 miles per hour or more. Now, of those storms, 6 to 10 of them have the potential to reach hurricane strength, which is wind speeds of greater than 74 miles per hour. And then of those 6 to 10 hurricanes, 3 to 6 would be major hurricanes, category 3 or greater, with 111 miles per hour or more. And so far we have seen storms named all the way to Edward. So it has been a fairly active season, and we're just now starting July. Now, none of those have reached hurricane strength, but active nonetheless. And this is kind of fitting in with what the National Weather Service prediction is, that this will be an above normal hurricane season. About a 60% chance for it to be above normal, only a 10% chance for it to be below normal. Now, we'll have to wait and see how accurate NOAA's prediction and outlook is for this year, but that's just a quick look of what we could expect in the Atlantic Basin.
All that being said, and you'll hear meteorologists say this often, it only takes one storm to make it an above average season for a certain area or community.
Yeah, that's exactly right. And that's why we also say often that the best thing you can do is to simply be prepared.
Yeah, so this hurricane season, keep tabs on the tropics by bookmarking the KSAT Hurricanes page on KSAT.com.
You can also download the KSAT 12 Hurricane Tracker app and track any tropical system right in the palm of your hand.
These are more than just the sounds of a safe place to go after school. These are the sounds of interest being ignited and of mentors making an impact. At Boys and Girls Clubs, we don't do just one thing. We do whatever it takes to meet the needs of every kid who comes through those doors. Because whatever it takes is what it takes to build great futures. Great futures start here.
Since 1990, Youth Q's mission has been to positively impact youth through the power of choral music. They've done this nationally and here in San Antonio through the San Antonio Youth Chorale. SAC not only helps the youth, but the community too. Now they need your help as they raise their voices to support the San Antonio Food Bank. Youth Q and San Antonio Youth Chorale would like your support in reaching their goal of raising $60,000 for the food bank. You can help them right now by visiting my.safoodbank.org/youthq and make a donation to aid the food bank. $1 can make up to 7 meals, so whether you give $1 or $100,000, you're changing the lives of those who receive that gift. Show your support now by making a donation at the link on your screen.
KSAT Community, in partnership with RBFCU, University Health System, and Energy Transfer.
Thanks for joining us for KSAT Explains. We've spent the past 2 episodes talking to local leaders and industry experts about the uneven impact this pandemic has had on our city and the possible solutions going forward. Next week, we are hearing the personal stories from those who are living with the reality of this problem. We hope you'll join us then.